Good afternoon, everyone. My name is Amanda Campen. I work with the Massachusetts Emergency Management Agency, focusing on public assistance for COVID-19. Just want to start by saying thank you for joining our call, really focusing on public assistance for other private nonprofits. So that would include housing authorities, homeless shelters, nursing homes, and the like. Before we really begin, just a couple of housekeeping items. A recording of this presentation, as well as the presentation itself, as well as a copy of any any questions we receive during this presentation will be available on our MEMA website and will be emailed to you early next week. In order to be respectful of everyone's time, we have muted everyone on this line. Muted everyone on this line. So if you have any questions at all during this presentation, make sure to utilize the chat function on WebEx, and that's going to be the button that has the dialogue symbol on it. You can click that button and submit a question on our chat. Make sure you share it with everyone, just so that everyone can see the question and we're not going back and forth. So before we get into the agenda, we really just wanted to give you an overview of the public assistance of the disaster for COVID-19. So a lot of questions we get are, what is DR 4496? What does it mean? So for every single disaster, each state gets its own disaster record. That's where the DR comes in. And that record uniquely identifies that disaster by state. So as we all know, each state has gotten a declaration for COVID-19. So the disaster record for the Commonwealth of Massachusetts for COVID-19 is DR 4496, which the president declared on March 7th, 2020, and goes all the way back to January 20th of this year. So that means you can claim eligible costs going all the way back to January 20 of this year going forward. This is an ongoing disaster, meaning there is no end date in sight. I think if any one of us had a crystal ball, we would probably make a good bit of money if we were able to predict the end of this, but we don't. So with that being said, you do not need to request a time extension at this time. I know when you log into Grants Portal, you might get some dates that look confusing to you. You can ignore them for now. When we do need you to request a time extension, you will have ample notice, and you will be getting a bunch of emails on when to do it and how to do it from your assigned project coordinator. This disaster has declared all counties within the Commonwealth, which means if you operate a facility within the Commonwealth of Massachusetts, you are eligible for public assistance. So if you operate a facility, apply for public assistance if you have not already. If you have applied for public assistance before and have received PA through other disasters that we've received, snowstorms and the like, you might be familiar with all the categories of work, whether or not your facility has received damage or you had to repair a road or anything like that. For this disaster, all that is authorized is Category B, which is emergency protective measures. You might ask yourself, what are emergency protective measures? We'll get into that a little bit later, and we will go into exactly what emergency protective measures means for this disaster. Before we go on, I just want to thank FEMA Region 1 for being great partners with the Commonwealth of Massachusetts in helping us administer public assistance and helping applicants. I do want to acknowledge Eleanor Canigo, who is on the line with FEMA Region 1. She will be helping me answer your questions. Again, utilize that chat function to submit your questions. And she will also be piping in when she needs to check me on something or she would like to add something more to my explanation. So again, want to thank Ellie for her time this afternoon and want to thank Region 1 for being great partners. So the agenda, what are we going to get into today? What's going to take up the next hour of our lives? So we are going to be talking about FEMA public assistance. A lot of you are first-time applicants, so there's just some high notes that I want to make sure you guys are aware of. Next, we're going to be going over eligible activities and costs. This disaster is very much unlike any other, and there are some unique items that may have been eligible in other disasters will not be in this disaster. So we're going to take a quick look at that. Well, a deep dive look at that, not a quick look. And then last but not least, we'll also go over required documentation. What do we need to develop your project? And again, if you have any questions during this presentation, please feel free to utilize that chat function. Again, has a dialog box to submit those questions. So for every single disaster, FEMA usually issues fact sheets. And fact sheets are useful in that it applies specifically for that disaster to help applicants determine what's eligible for FEMA public assistance and helps them navigate the process. This disaster is no different. So the two main fact sheets that will apply to most of you and most of your entities are the Emergency Protective Measures General Fact Sheets. There are two of them, and they're different in that they are for different periods of time. So the first fact sheet applies to activities performed before September 15th. And the second activity is for activities performed after September 15th. We'll be going over both of those in a second. I will say the first guidance, the pre-September 15th one, is rather general. It is a little bit vague. And then when we get to the post-September 15th guidance, it is, I think, a lot more specific, a lot more direct, a lot more clear-cut. So let's dive into both of them. But before we do that, we will go over the FEMA Public Assistance Program. So what is FEMA Public Assistance? Again, most of you are first-time applicants. You might not really have a great understanding of what this grant funding is. So it's supplemental financial assistance that's provided by FEMA. It's only available to state, local governments, tribal governments, and certain private nonprofits, such as yourselves, for emergency protective measures for COVID-19. And really, the purpose of the FEMA Public Assistance Grant is to provide resources that would otherwise restrain your efforts to respond to this disaster. This is a cost-share program, meaning that FEMA will only reimburse 75% of your eligible costs. Now, what does that mean, right? Kind of confusing. So let's say you're able to provide all the documentation and justify $1 million worth of eligible costs. FEMA will only pay $750,000 of those costs. You, your entity, will be responsible for the remaining 25%. So you will have to come up with $250,000 or be responsible for that $250,000 of the costs that you have already expended. If you have any questions on that, please feel free to utilize that chat function. Now, I do want to bring attention to that last paragraph that is bolded and italicized for your convenience. FEMA will not duplicate any assistance provided by HHS, CDC, or any other federal agencies. What does that mean? Very simple. Simply put, no double dipping. So if you cannot claim the same activities, the cost for the same activities across multiple grants, make sure that you have separate listings of what you are intending to use each funding for and keep them separate. No double dipping. Now, what is emergency protective measures? It's so vague, right? It's kind of broad. So the statutory definition is an emergency protective measure is an activity undertaken to eliminate or lessen an immediate threat to lives, public health, or safety. Now that sounds like that can include anything under the sun, right? Not the case. So let's do a deep dive as to what is an emergency protective measure eligible for reimbursement for COVID-19. So let's start off with that pre-September 15th guidance. Before we do a deep dive, let's go over the bottom here. So in order to be reimbursed for these costs, your entity must first have the legal responsibility and it must be an eligible emergency protective measure. So what do we mean by legal responsibility? This is a question that applies the most to you guys, to private nonprofits that offer certain services. So depending on what you guys are doing, there's a lot of services that are considered not the legal responsibility of, private nonprofits, but are rather the legal responsibility of government, right? Makes sense. Government, we expect them to do certain activities that other entities shouldn't provide or don't provide in a typical setting. So a couple of activities that we only expect the government to provide, and it's not the legal responsibility of a private nonprofit, would include non-congregate sheltering, community-based testing, and emergency feeding. So again, some activities that are the legal responsibility of government include community-based testing, non-congregate sheltering, as well as emergency feeding operations. Now, if you guys are performing those three functions, let's say you're a food pantry or a homeless shelter, you guys will need to communicate with either the state government or local government to see if you can contract with them to provide these services. It would then be that government, that agency or local government that would seek reimbursement on these costs, not you guys. Again, if you have any questions, I know that may have sounded a tad confusing. If you have any questions, please utilize that chat function and we can go over that again. So with this pre-September 15th guidance, I really want to emphasize the eligible emergency protective measure part. So what is an eligible emergency protective measure? Really, an eligible emergency protective measure is to respond directly to COVID-19. So this listing here, bullet points, really shows every single activity that we are deeming eligible for reimbursement. But if you are responding to COVID-19, I know a lot of you are seeking disinfection of your facilities, so the cleaning of your facilities. But look at this next part, disinfection of eligible public facilities. In order to be an eligible public facility, you have to, one, be open to the public, right? But then also be performing some sort of an emergency protective measure in there. Maybe you're offering emergency medical care. Maybe you're, an ambulance service and you're transporting COVID-19 patients. Again, if you have any questions on that, let me know. But if you are not performing an eligible emergency protective measure, that is going to be a problem to get those costs reimbursed for that disinfection. Trying to see what else. The purchase of PPE. Again, if your folks are not performing an eligible emergency protective measure, the cost for PPE is not going to be eligible for reimbursement. Let's see, what other costs have we seen? And again, if you have any costs that we're not going over, or I'm just skipping over, that you want to discuss more, please utilize that chat function and we can talk more about that at the Q&A at the end of the session. So going to the post-September 15th guidance. A lot more clear cut. I'm going to actually skip to the next slide as well. We see eligible emergency work is performed. Always that little caveat, eligible emergency work is conducted. You need to make sure, you need to evaluate whether your facility is performing eligible emergency work. If you are providing that, emergency medical care, if you are responding or providing management activities to respond to COVID-19. If you guys aren't, you do not have a facility that is eligible, that is performing eligible emergency work, that you are performing eligible emergency work out of. That being said, if you have a facility where eligible emergency work is not being performed, post September 15th, you can get reimbursed for cleanings of the facility after there has been a confirmed or suspected COVID-19 case. So again, if you have a facility where you're not doing eligible emergency work, You can still get reimbursed for cleaning your facilities, but only if it was a result of a suspected or confirmed COVID-19 case. Leave that there. Next, the PPE. Again, if you are distributing, masks, face shields to your staff, but they're not performing eligible emergency work, that's not going to be eligible for reimbursement. And the same applies to what we discussed earlier with the legal responsibility. If you're not a state, local, or tribal government, the activities we described, you do not have the legal responsibility for, and you will need to get with your state or local government to get those costs reimbursed. Next, documentation requirements. So if you have not had your exploratory call with your project coordinator, please get with them to schedule it. You will learn a lot of awesome things about the FEMA Public Assistance Program, to include the difference between a small and a large project. A small project is a project that's between $33,100 to $131,100. This is what we're going to need. So first, we're going to need an electronic streamlined project application. This can only be completed on FEMA Grants portal. Do not send me a PDF via email of the application. We will not accept it. It must be completed on Grants portal. Second, we will need a completed MEMA workbook. This is available on our MEMA website, or you can email your project coordinator. They would be more than happy to send you an updated version of it. And this is going to just be an itemized, line item by line item, all the costs you are trying to seek reimbursement for. Now, if you have an Excel sheet that you have been working out of since January 20, and you have thousands of line items, that you do not want, that you just don't want to, go through the administrative burden of re-entering those line items into the MEMA workbook, let your project coordinator know. We will work with you. Next up, subrecipient small project certification form, also available on our MEMA website. You can also email your project coordinator. They'd be more than happy to send you a copy of this form. What it is the listing of assurances to make sure that you understand that what your obligations are at closeout, and in the case of any audit that might come up. You are expected to have all of your source documentation. By source documentation, I mean invoices, timesheets, receipts, all that stuff, in case your costs are ever questioned. We will ask that you certify that you will be able to provide this information when asked, as well as a couple of other assurances. Additionally, we will need a procurement policy, as well as pay policy and any applicable union contract. We need to make sure we review those for 2 CFR compliance. That's all you need for a small project. For a large project, there's quite a bit more that we need. So as they say, with more money comes more responsibility. With more money comes more documentation. So first, you need to fill out the electronic streamlined project application, which can be done on the grants portal. The MEMA workbook, which also similar to the small projects, what we need for small projects. Procurement policy, pay policy, and applicable union contracts. But what we also need then is the source documentation for all the costs that you claim. So let's say you claim overtime costs, like you're cleaning your facilities and you're using, you have a custodian on staff, and their overtime is eligible for those cleaning costs. You will need to provide their timesheet, as well as proof of payment that they were paid that overtime. So usually it's just time roll registers will suffice. If you have forced account equipment costs, so let's say while you're cleaning your facilities, you have, like a disinfectant sprayer that you had before COVID-19, you can get reimbursed for the hourly usage of that equipment. That's also a really great reason why you should use the MEMA workbook. The FEMA's equipment usage rates are already built into it, so it's very convenient, very easy to use. What we will need for those costs is just a timesheet or a log of when it was operated and for how long, and then also proof of ownership. I know that gets a little bit daunting, especially if you have a piece of equipment that you've owned for years or sometimes decades. We will work with you to get that to suffice that requirement. Let's say you purchase cleaning supplies, materials and supplies. We'll need, those invoices, those receipts, proof of payment. Usually receipts will suffice, or if you have a bankroll statement or cancel check, as well as any procurement documentation. For the most part, that's not going to be applicable to you guys because most likely your procurement for any materials and supplies are going to be rather small. But again, we'll work with you guys to make sure that you have the appropriate documentation for those costs. Contracts, let's say for cleaning, instead of using your in-house custodian, you decided to hire a cleaning crew to come in and clean after you had a suspected or confirmed COVID-19 case. We will need those invoices, receipts, proof of payment that the vendor is paid, any contract agreements you might have with that company, as well as any procurement documentation that you may have. Again, if you have any questions, please feel free to utilize that chat function so that we can get to your questions at the Q&A. And that is it. Nicole, do you want to go into any questions that we may have?
Sure. Let's start with a question from Tao Nguyen Lee. What do you mean by legal responsibility?
So legal responsibility is that I guess I'm trying to come up. Ellie, do you want to help me out here? I guess I'm just having what is legal responsibility? It's that you are authorized to do that activity, that you by statute, by charter, by law, have to do that activity. So we see a lot of, governments that have to do certain things by law, right?
Right. Exactly. Legal responsibility for feeding programs, for example, usually falls under the town or city. And you need to, if you're doing that, you need to have some sort of agreement with the town or city that you're going to do this for them, and you're going to submit your expenses to the town or city, and they will in turn submit it to FEMA.
Thanks, Ellie. Appreciate it.
And we can move to the next question, also from Tao. I am from a youth agency and have been providing food and PPE to the community, and we have also purchased PPE for our programs. Would this be eligible costs?
So most likely not, unfortunately. If you're providing emergency feeding program and PPE to the general public. So PPE to the general public is just ineligible. Even local governments aren't able to seek reimbursement on that. If you're providing emergency feeding to vulnerable populations, such as the elderly, folks with suspected or confirmed COVID-19, with suspected or confirmed COVID-19 patients, or autoimmunocompromised folks, you would really need to seek a partnership with your local government to try and get those reimbursed, where you would almost act as a vendor on behalf of the town to perform those activities. But unfortunately, you will not be able to seek reimbursement on those costs directly.
All right. Next question from Deborah Watrous. DHCD is serving as a go-between for mass nonprofits with FEMA. Is this the same program, or is this for a direct application to FEMA?
So I don't know, Thad, if you want to join in here, and I apologize, I didn't see you on the call earlier. So my understanding is DHCD is acting as a go-between for Massachusetts providers providing homelessness relief. in order to, so that they will seek reimbursement directly from FEMA. Thad or Dave, I think Dave may be on the line. Do you want to add any more to that?
Yeah, sure. So that is correct. We're working with DHCD, who's working with the homeless shelter providers as vendors because they're not, FEMA does not allow them as applicants. So the state is the applicant and the homeless shelter providers are vendors. The source of funding is the same, right? So if you are a homeless shelter provider working to get your costs submitted to FEMA, that is the avenue to pursue. This is the same funding, but you can't apply directly just because the eligible applicant has to be the state or local government.
Next question from Tracy Davis. Can you provide more information on emergency services? We are a residential care setting and purchase PPE. Are you stating that there needs to be a suspected or positive case in the residential home to recover these PPE costs?
I think we would need to have a little bit more information as to the services that you provide, Tracy. Is it, do you guys provide any like medical services? Is it more of a nursing home or an assisted living type situation? If it is more of a nursing home or assisted living facility where you guys do, offer medical services, the PPE provided staff should be eligible. But Ellie, do you have any thoughts on that?
No, pretty much what you just said. We need to have more information, and then we can make a determination on what your claim is as to the eligibility.
So Tracy, if you just want to add some more to that, we can get back to your question later as we continue to take questions.
Yes, and honestly, she can submit what she has for expenses, and we will guide her and let her know what is eligible out of those expenses.
Next question from Andrew Steiner. We previously applied for a FEMA PNP public assistance grant in May 2020. It is still not approved and stuck at FEMA OCC review. How can we get our application approved?
Thank you for your question, Andrew. You're not the only private nonprofit that falls into this boat. FEMA is working very diligently on reviewing requests for public assistance, especially for private nonprofits that are first-time applicants that are just a little bit different than what they're used to seeing. FEMA is very diligently working on getting these applications reviewed and getting requests for information out promptly. But Ellie, I don't know if you want to add to that.
You're absolutely correct. So our OCC reviewers are reviewing applications for 6 states here in New England. So it takes time to be able to go through each application and make sure that all the necessary documentation has been uploaded. And if you receive a request for information, they need to respond to that as promptly as they can so that we can process their application.
All right. Next question is from Al Cornish. We are a regional housing authority and closed to the public, except for limited by appointment meetings. We are doing this to protect our employees. In addition, we are doing additional COVID cleaning on our properties and in our office. Would these cleanings and PPE be covered?
So the cleaning should be covered. Again, if you can provide narratives on, suspected and COVID-19 cleanings, that would be, that would definitely help for cleanings for your entity type. Just make sure you're not claiming routine cleanings, so cleanings that you would have otherwise done before COVID-19, or just cleaning just for the sake of cleaning. You know, we want to see some more documentation. And PPE, Ellie, if you want to jump in on this, PPE for your staff to do cleaning will be eligible, but most likely the PPE for your staff just to have doing their routine business would not be eligible.
And again, you're absolutely correct. If they purchased masks and gloves and different items to do this initial cleaning, that would be eligible, because some of these disinfectants are very strong. But if you're providing PPE to your staff or anyone else, that would not be eligible.
All right, and there's just a clarification here from Michael Tobin regarding the residential care setting that Tracy Davis was referring to as a congregate housing for folks with disabilities.
Got it. I think I would still need a little bit more information on that. Again, really stressing the, you know, what kind of medical services are providing in the residential care facility. But if you would like to take this offline, I have my email right on the screen. You're more than welcome. We can definitely talk it out. It really just becomes a very, especially with residential care facilities, it just is such a fine line of, you know, what's just like almost like a residential community versus an assisted living situation. It's just such a fine line. We can definitely talk about it and figure out the best way to present your costs to FEMA for sure.
Peggy Payton would like to know any construction costs to protect staff and residents covered.
Most likely not for your entity. Again, it depends on what type of facility or what type of entity you are and what services you provide. But any renovations to facilities will most likely not be eligible for reimbursement. Ellie, I don't know if you want to add anything to that.
No, that's fine.
At this time, Amanda, there are no questions pending in the chat.
Thanks, Nicole. I just want to thank everyone for joining us here today. If you have any other questions that you just did not think of to ask during this presentation, you're more than welcome to utilize the link that we have at the bottom of the slide. It goes to the form stack on our website where you can submit questions and we will answer them to you via email. To bring us in for a landing, I want to introduce Thad Wigmore, MEMA's Assistant Director for Recovery and Mitigation, to bring us in for that landing.
Thanks, Amanda. Totally want to thank everyone for taking the time to join us here today. Obviously, this is an unprecedented disaster in many ways, not just the fact that it's a pandemic as opposed to a hurricane, a flood, or a nor'easter as we're used to, but that the disaster period is still open and you're still potentially incurring costs. And so 8 months in, we thought it would be prudent to take time to sort of conduct these with you, to open up for questions and sort of share lessons learned. So again, thanks for taking the time today. And at any point, if you have any questions, please feel free to reach out. Thank you.
Thanks, Thad. And again, thanks everyone. So that concludes the presentation. Have a good rest of your day.